Hello everyone, welcome to White Coat Medicine Talks. This is Dr. Carlos Ornedo talking today on depression, a subject that is very common, and I wanted to go step by step about how our office gives us that information from a patient that we sometimes may miss. You know, they may be coming in for sore throat or follow up on their diabetes. And so whenever we do annual physicals, we try and do a screening test. And so it's called PHQ-9 depression scale. So this is helpful for us to be able to screen our patients, not only in our annual physicals, or whenever we see them feeling a little bit down or blue. We like to use this as sort of something to go by, but let me just give you some idea. So as we go through this, I wanted you to just sit back and think about some of these questions, but it is a difficult thing to be able to see if someone's depressed, or has also related anxiety, or they're grieving. So depression, a loss of interest, such as, you know, I love playing golf, and all of a sudden I don't really care for it. That is one of the big ones that I see in my office, an interest that someone likes to do, you know, all of a sudden stops doing it. They rather just not, you know, be part of that. And that is something that is a sign. Is this person depressed, or what's going on? It sort of gives us the idea there's something else going on. Another thing that we ask on this PHQ-9 depression scale is, does the person feel like just really tired, and actually says, you know what, I do feel depressed. So it's very difficult sometimes for maybe more men than women to express themselves. So this is where I see these things play out, and it's really very helpful. Or if they say, I feel hopeless, so you have to go through step by step to make sure that this is someone that we need to go through and detailed about what is actually happening. And I see those that are seeing this video, talk to your family practitioner, your primary care doctor, and for more information, of course, and treatment. So falling asleep or trouble or sleeping is always a big issue. And so sometimes sleeping too much or not sleeping enough can give you some indication there's some anxiety, some depression, or other things even could be more related to medical problems. Just the fact that they're tired, you know, coming in with low energy, as many say. So these things can be hidden, so it's important to keep going. Another question is about appetite. You know, I'm eating all the time, so we see a lot of that, stressful eating, and maybe related to a problem or how they're feeling, so that's something that's important. Not eating enough, or just like, you know, I just haven't been eating and they're losing weight. So, you know, there's another indicator. Feeling bad about themselves, sort of a guilt is very big, where, you know, they themselves maybe have some low self-esteem, or they're just going through some rough patch and they're just not talking about it. And so that's another good sign. We have a few more here. Trouble concentrating, and it may be that some of these are all related. You know, we have, as I was talking in videos before, on estrogen or treatments of another type of condition, or lack of some hormone, you can have, you know, this lack of concentration. or it could lead us down the road of other medical problems, ADHD. There's other things out there that are related. So a couple of more here. Also, if they're fidgeting, feel a little restless, and they take it further by telling you, my thoughts are that I'm better off dead. And so you have to be very, very careful and try to really reach out to them and talk to them about, are they having a plan? Did they create something that they may hurt themselves? And we will be probably wanting them to maybe see the psychologist at that time. So that becomes a real serious thing. So severe depression would be what we're trying to avoid and try to help, and it becomes very, very important to try to get those that say these things. And so it's always important to have that 1-800-suicide number that they could call, and also get them some help as soon as possible. So as you can see, there's various things that are very important and sort of specific to many other things, but this is a great tool that as a family practice doctor we could use, the PHQ-9 depression scale, that I believe that once you've diagnosed, whether it's a mild, moderate, or severe, you're going to probably use it more often. It could be every time they come in. And once you've given them a treatment, send them to the proper specialist if they need to go, you have a good follow-up, and you're keeping tabs on some of those patients that you are concerned with. We would go a little bit more in detail on the next talk about treatment for depression. Thank you.